For the neck, imaging evaluation is one of the most significant separating points between OrthoCure Clinic and the vast majority of clinics that are now starting to do regenerative therapies. Traditionally, X-rays and MRIs have been used to find the pathology, which in the healing paradigm is the G, the grade of defect. But processes and approaches for doing regenerative injections vary widely, from doing disc injections to joint injections to some individuals now learning how to do ligament injections and other tissues that can be combined to treat the neck regionally. It's important to consider MRI for the neck because there might be space-occupying lesions. We might need to understand that there's a very small amount of space around the spinal cord and be very careful where we're putting our needles. Where things are generally safe, it might not be safe in that particular situation. So it's important for a good general evaluation of the neck to do an MRI. X-rays are not very helpful for the neck. If you add a flexion and extension component to the neck and see if there's translation or movement of one vertebra on another, that helps you understand where some of the underlying instabilities are. But in my experience, which goes back to 2010, using what's called digital motion X-ray to evaluate which capsules, ligaments, joints, and discs are unstable, weak, and allowing for abnormal motion is the most critical test imaging-wise to do for the neck. It's very uncommon. There are not very many practitioners through the United States that have very much experience doing these imaging evaluations. The individual that does them for me, his name is Dennis Wogan, has been doing it for 15 years and has been an individual that's created some of the technology. He was in fact trained by the individual who started digital motion X-ray in the United States. He and I, that's Dr. Dennis Wogan, and I have created combined protocols for treating the neck using digital motion X-ray, regenerative injections, chiropractic, and physical therapy interventions for the last 3 years together, and treated hundreds of patients. Without a digital motion X-ray, it's not possible to treat the neck adequately from regenerative injections. The most critical area of the neck in general is going to be the two upper segments between the head and the first vertebra, that's the atlanto-occipital joint, and the atlanto-axial joint, which is the second set of joints. There are a lot of critical neurologic and vascular structures that are around these areas doing injections, and they must be done with ultrasound and fluoroscopy combined to do them safely and effectively. That'll be seen further on in the website. But Dr. Wogan and I have created our own sequences of evaluation imaging in certain positions to more completely treat the neck than I'm currently aware of any other individual doing in the country. It's very common for me to do 35 to 40 injections. I know that sounds a little scary, but for 35 to 40 injections based on very careful imaging and planning. But the interrelations of temporomandibular joint, sternoclavicular joint, acromioclavicular joint, muscles and nerves, fascial planes, together with the pathology in the shoulder, makes it a very challenging area to work on from that level of complexity, but also challenging from the risk aspect of it. So these are not injections that should generally be done by individuals that have a lesser degree of training. And I don't want to make a judgment on that, but I want to caution people that this is something that should be considered very carefully.